So hello all and good afternoon, and thank you for joining our 5th Neglected Tropical Disease Lunchtime Talk of 2020. I hope you are all well at this time. For those of you who do not know me, my name is Alyssa Mariner, and I am the Communications Officer with Sightsavers NTD Communications Team. And could everyone please remember to mute themselves during the presentation? And just so everyone is aware, we will be recording this talk so that we can share it with you at a later date. I'm very excited to introduce Anita Guom and Joy Shayabu from Sightsavers Nigeria Country Office and Delphine Demboy from Helen Keller International. Today, they will be presenting their talk entitled Rising to the Challenge in Nigeria, a Year in Review. Nigeria is receiving a significant proportion of the Ascend West and Central Africa Program's investment funded by DFID. In this session, our Sightsavers Nigeria Country Office and implementation partner Helen Keller International will talk us through some of the key successes, challenges, and programmatic adaptations they have undertaken to achieve some significant milestones. I will now pass things over to the presenters to officially kick things off.
Hi, everyone, and thank you, Alicia, for introducing us. You're all welcome, and thank you for joining our lunchtime talk today. Hopefully, we will be showcasing the impact of UK aid in Nigeria through DFID's flagship NTD integrated program, the Ascend program. The Ascend program is a complex multi-country program. So for today's session, we will be focusing on Nigeria, the second largest country in the West and Central Africa lot. We will introduce you to our speakers and hopefully share with you the Nigerian context, challenges and lessons that we have learned from year one of the program. So I think we'll go ahead to meet the speakers. Interestingly, today we have an all-female Nigerian panel. Representing the team is Anita Guom, who is the Ascend Country Capacity Builder from our Finance and Performance team. Delphine Demboy is joining us from Helen Keller. She is the NTD coordinator. And I am Joy Shayabu, as has been introduced, and Director of Program Operations here in Nigeria. On the Ascend program, we have a total of 47 staff in Nigeria. And this ranges from staff in program management, finance and procurement, research, as well as monitoring and evaluation. And Sightsavers Country Office is located in Kaduna, and we would like to show you a little of what Kaduna looks like in the next slide. Yeah, so the video that you will be watching is a representation of Kaduna State. This gives you a snapshot of where the country office is located and where we have worked as Sightsavers. Kaduna is in the northwest zone of the country, and the name Kaduna is derived from a Hausa word called Kada, meaning crocodile. And Kaduna is home to over 60 different ethnic groups. And this gives you an example of the type of terrain where communities are located, and we have to work to reach people who live in these communities. There are lots of fast-flowing rivers in Kaduna, and this is the perfect breeding site for the black flies that spread river blindness. But thankfully, this is no longer endemic in Kaduna due to the sustained support from the Nigerian government, DFID, Sightsavers, and its partners. So under the ASCEND program, we are going to be working to make sure that there are more states in Nigeria that can be declared free of NTDs. Okay, so talking about Nigeria. Nigeria is the most populous country in Africa. We carry about 25% of the burden of NTD in Africa. So that makes Nigeria one of the most endemic countries in the world for these debilitating conditions. An estimated 100 million people in the country are at risk of at least one NTD, and there are several million cases of co-endemicity where you find people are infected with more than one NTD. The Nigeria's integrated NTD program began approximately about a decade ago, and this started with the integration of river blindness with lymphatic filariasis and trachoma. The map that you're currently viewing shows endemicity of lymphatic filariasis and river blindness in Nigeria. And as you can see, most states are still being impacted by these diseases, and there's critical need to keep up the momentum and control and eliminate these diseases. And this is exactly where the ASCEND program comes in. So for those of you who are not aware, ASCEND is a commercial contract which will be running up until March 2022. In West and Central Africa, it covers 13 countries, and this is led by a consortium of 4 partners. Sightsavers is the key supplier to DFID, and we're responsible for delivering this contract. The key activities include integrated mass drug administration, surgeries for lymphatic filariasis and trachoma, disease-specific assessments, health system strengthening, WASH coordination, behavior change communication, the COVID-19 flexing, and of course, the Leave No One Behind disability inclusion. In Nigeria, ASCEND is supporting 17 states. 13 of those states are for MDA exclusively. 4 of the additional states being supported to deliver on TT surgeries. The endemic diseases that the ASCEND program is supporting include river blindness, which is caused by the black fly, lymphatic filariasis caused by a female mosquito bite, and this usually will result in swollen limbs and groins. Schistosomiasis, which is caused by fluke worms that infest the blood and also urine. We're also tackling intestinal worms, which is an infestation of adult worms in the intestine, and trachoma, which is caused by a bacteria and causes the turning of the eyelashes, which irritates the eyeballs, and if not treated, can lead to irreversible blindness. Thankfully, these diseases are treatable, even though many people have not been reached with the medicines that are required and other interventions because of the challenges in funding, the logistic challenges as well, and some people as a result of the misconception themselves. And I would say that ASCEND has set itself quite ambitious targets. So over the next 3 years of the program, the support for ASCEND in Nigeria will translate to £30 million in funding to provide 196 million MDA treatments. Approximately 6,000 people will receive surgery for lymphatic filariasis, and 26,000 people will receive treatment for TT. Ultimately, the ASCEND program aims to leave a legacy for Leave No One Behind and strengthening of the health system for an inclusive and sustainable national program. So if you've been following, you understand that this job that we need to deliver on in the Ascent program is not something that can be done by Sightsavers alone. So there's a strong consortium leadership and downstream partner network in place to ensure that we deliver on all that is expected of us. So in Nigeria, we are working with 3 non-governmental development organizations, the Mitosat, HANS, and the Helen Keller International. And this is not only a job for Ascend alone because of the magnitude of what is required. And therefore, we have an ongoing coordination with other programs and partners, including the Accelerate program that is being funded in Nigeria, the Give Well program, and the USAID Act to End program. And most of the places where we work is highlighted on this map currently. And Ascend is rising to the challenge in Nigeria. Is coming to you today as a result of the successes and learnings of our past programs. There are 3 notable programs that we would like to highlight that we have learned from. The DFID United, the UK Aid Match, and the DFID Save programs. These programs supported significant scale-up of MDA and NTD interventions in general in Nigeria. And the Ascend program is here to sustain the necessary momentum to control and eliminate these NTDs. An example of our learning from the past is from the UK Aid Match program, where we conducted a learning session that identified that it was possible to treat comorbidities, hernia and appendicitis, and of course, with improved surgical outcomes. We also had advocacy during that program that led to the reduction of surgery costs by an outstanding 30 to 50%. Some of the work that we have done has resulted in the development of the first draft of the morbidity management and disability prevention framework for lymphatic filariasis. And with this, I'd like to pass on to Anita to run us through the 1 challenges and the lessons that we have learned in the implementation of the program so far. So, Anita?
Yes, thank you, Joy. Thank you. Learning from the past is one aspect that is a core component of Ascend. Collaboration is another, and this was first demonstrated in the way the consortium came together during the inception. The Ascend program started out as a race against the clock with a 3-month inception period. We were presented with all the usual challenges, from gaining government buy-in to setting up partner agreements. We were also tested by the number of inception deliverables that are required for a program of this size and the donor funding commitments. We manage administrative burden through harmonization of the processes and templates. For example, we were able to standardize templates for trachoma, which were used by both Ascend and Accelerate programs. We also overcame technical and operational challenges through leveraging existing resources and assigning dedicated Federal Ministry of Health staff. For example, we use the same technical team and reporting tools and processes from the previous UK Match and Commonwealth programs to implement in new states supported by the Ascend program. We also brought in a procurement and logistics specialist who is based in Nigeria. We sped up our usual timelines by leveraging existing relationships. For example, through joint efforts, conducting a series of informal meetings with our downstream partners and also the Federal Ministry of Health staff. But at the start, there was a reasonable confusion from the Federal Ministry of Health about the role of Ascend in Nigeria. Some of the questions that were asked were, is Ascend a continuation of United? What difference will it make? How does the consortium model work? And who is responsible for what? Therefore, building and reinforcing a shared vision was essential during the inception period. We took 2 key actions to achieve this. By jointly agreeing targets and budgets for the Mass Drug Administration, and also for the MMDP program with our downstream partners. We also cascaded startup meetings to all our downstream partners based at the state, which established the ways of working in the consortium. Next slide, please. After an unprecedented start to the program with a rapid inception, we thought we had overcome the hardest part of year 1. Yet, year 1 has presented us with ongoing security threats and unforeseen government issues on NZ duties, with also a new regulations and insufficient budget. These issues had direct impact on the timely distribution of drugs for MDA, subsequently delaying our campaign schedules and delivering on the treatment numbers. This was more difficult in some states than others, especially our experience in the Northeast, which Delphine will be sharing with you. However, despite these setbacks, whilst we are working towards achieving our targets, year 1 of ASCEN came to an unprecedented end. In March 2020, earlier this year, we were exposed to the uncertainty of COVID and had to put a hold on some of our activities and also in the collection of treatment data. Next, please. Our presentation is called Rising to the Challenge for a reason. Putting aside the challenges we faced, we can share several achievements. These include, firstly, Nigeria achieved the highest number of implementation units treated, where we managed to achieve overall 89% coverage for MDA. I'll give some examples of how we did this. By adopting a campaign approach in urban areas, identifying and working with community influencers in major settlements in semi-urban and urban areas, and also by facing our MDA by districts. We also supported celebrations on World Sight Day. An example of this is in Kaduna State, where the team conducted a musical road march along a high-profile area of the state. And we increased visibility of the supply chain for donated drugs and the early warning delays through the country risk register, and also developing guidance tools for NT Deliver. Overall, a key factor of our success lies in our relationships with partners like Helen Keller International, delivering on the ground in high-risk areas, and through having a key focal person at the Federal Ministry of Health. Next slide, please. We cannot achieve without relationships, as I mentioned earlier. And one of the most important relationships for NTD program is that of the community volunteer. MDA relies on engagement and involvement of community leaders and community members, because trust must first be established for community acceptance. MDA also relies on volunteers chosen by their communities to distribute drug treatments. Under ASCEN, we are strengthening community ownership of the NTD programs by building the capacity of community volunteers. In Nigeria, we have supported and cascaded training for 115,810 CDDs in year 1 only. This training educates community volunteers on the diseases, and in turn, community volunteers educate members of their communities. Up until March this year, this is how we deliver MDA, as is shown in these photos. But with COVID-19 risks and as per WHO guidance, MDA is subject to physical distancing measures. Next slide, please. Next slide. Next. Okay, as you can see, MDA is a major part of NTD program. However, it is not the only strategy for the control and elimination of NTDs. Mobility management and disability prevention, MMDP, is providing mobility care for those already suffering from disabling clinical manifestation of diseases caused by LF and trachoma. In Nigeria, we manage the complexity from multiple donors by aligning systems, processes, and tools. An example is one that the Accelerate program focus on case finders activities, while Ascend milestone is in the number of TT surgeries conducted with payment done based on the number of TT surgeries performed. We also face a vast geographic area to cover for case search and also not meeting TT targets due to security or low community acceptance. But we're able to mobilize communities and also integrated with MDA for LF case searching, leading to achieving over 200% of our set targets for year one. We overcame bureaucratic bottlenecks of the public health services, hospital services, through advocacy, where the program and state Ministry of Health teams pay advocacy visits to the management of the hospital services. An example of these issues are mainly due to the surgical component of LF-MMDP, which sits in a different unit in the Ministry of Health. And so you see there is a disconnect between what is agreed at the program level and expectation the program with the expectation that the program will supply all the surgical consumables. And hospital staff also claim not to have received official letters that we normally send that are required to schedule surgeries in the general hospitals. And this creates unnecessary delay during planning. But also good to note, ASEN has addressed the surgical waiting list of over 800 patients from the previous UK March program. Next slide. An example of the debilitating impact of an NTD and how simple and effective the treatment is observed in Rashida's case. Rashida first noticed her first swelling when she was just 15 years old. Her parents took her to see a doctor who did some laboratory investigations, took an X-ray and gave her some medication. However, the leg swelling continued. The thing that bothered her the most was the stigma whilst at secondary school. Her classmates gossiped behind her back that the swelling was as a result of her being pregnant. But as a result of lymphedema management training on consistent washing and exercising, she soon noticed reduction in the swelling. This motivated her to continue with the practice. She's now very happy with the result and hopes that her leg will return to normal. She continues to ensure that her family and herself take the yearly albendazole medication. Next slide, please. Leaving no one behind is a commitment we have made as part of the ASCEND program. In Nigeria, the Leave No One Behind strategy was a new concept for some partners. As a result, proper planning and documentation was not in place. For ASCEND, we learned from the experience of previous DFID programs, which paid close attention to cross-cutting issues, which helped with the implementation. And as a result of this, the NTD Health Management Information Tool, the HMIS, is currently being reviewed to capture disability data. We anticipate we'll be able to have disability indicators in place by 2022. The provision of a template by ASCEND and tracking implementation has helped us to improve understanding of what the focus of Leave No One Behind should be. We are also advocating for representation in volunteer demographics. And looking ahead, we will create space for cross-country learning exchange to be shared, for us to share successes and also challenges across the countries. Next slide. Health system strengthening is a key component which is being managed by Moat McNaughton in the ASCEND program. And health system strengthening is cross-cutting and largely depends on donor funds. A key challenge here is government ownership. And it is important to have entities in the mainstream health agenda under Universal Health Coverage, UHC. Also, there are multiple health programs that engage the same community volunteers. And this leads to competition, fragmentation, and duplication of efforts. Pooling of stipends and allowances for these volunteers could address these issues and offer economies of scales. To date, our high-level advocacy has encouraged the government to fund drug transport and MDA supervision in some districts. While in year 2, we are going to be focusing on advocacy for the prioritization of NTDs for its inclusion into the basic minimum package for healthcare services. Next slide. Enabling communities to self-monitor will need to be reinforced in the face of increasing security threats and COVID. Capturing beneficiary feedback by using various methodologies, such as case studies, program reviews, and by the use of questionnaires, we have identified that increasing security threats are impacting on the acceptance of male volunteers, particularly in urban areas, as they are thought to be key perpetrators of security issues. We are also addressing this issue by advocating for an increased involvement of more women and other potentially marginalized groups in the implementation of our programs. In year 2, Nigeria will be part of the global review to further improve beneficiary feedback and adapt program delivery to suit beneficiary needs. Next slide, please. ASCEND has marked a new approach to learning in our NTD programs. As a result, we have embedded a learning culture, which has a new framework, and we call it CLA, collaborate, learn, and adapt. And it's all about intentionally putting aside time for learning through pause and reflect workshops and taking actions through learning plans. It gives learning its rightful place in the program work plan. And it is not just an internal exercise. We are also involving our partners and other stakeholders in this. For example, in Nigeria, we facilitated a supply chain strengthening workshop, which was attended by representatives of the HIV national program. This helped the NTD team to cover an opportunity for integration into the health system, particularly in the area of logistic management. It takes time to implement change, but we are working towards these goals. And it was also while we were taking time to pause and reflect that enabled this. Next, I will pass over to my colleague, Delphine. She will share with you the experience of working in high-risk areas. Thank you.
Thank you very much, Anita, and good day to everyone. Slide, please. The experience we're sharing today is about working in high-risk areas. Northeast Nigeria is stricken by insecurity, mainly Boko Haram terrorism. We faced late arrival of drugs to the country due to the stricter government bureaucracy of obtaining waivers. We also had to contend with security issues in the movement of MDA commodities due to the NGO anti-terrorism bill. This impacted the planning and scheduling of our campaign. Delaying MDA is costly. It means loss of gains made in previous years. We overcame this challenge by involving high-profile people, the State Ministry of Health, the wife of the governor, as you can see from the picture, to support last-mile distribution. We also did by employing interstate peer support strategy, which means a model health worker is engaged to support health workers in other districts. We also did by empowering communities to self-monitor through training of health workers and engaging independent indigenous monitors. We also collated MDA reports remotely by taking snapshots of registers and sending via WhatsApp. Thank you very much, and I'll hand you over to Joy.
All right, thank you, Delphine and Anita. I'd like to encourage that if you have any questions, please put it in the chat box. We're conscious of the time, but we'll try and answer as many questions as you have. So if you have any question at all, you can put it in the chat box because we're coming towards the end of this presentation. And as we come to the conclusion of this presentation, I'm sure you're asking the same question as we're asking. Looking ahead, what is next for the Ascend program? So for the next decade of the integrated NTD program in Nigeria, we will be looking at the lasting impact and response to COVID-19 and how we can ensure that our programs are run concurrently. Our first step is supporting the federal NTD team to safely restart the MDA according to the government guidelines. And for us as an organization, this involves applying the risk management and mitigation tool, which we call the RAMA tool. This is an initiative of Sightsavers that is completed in consultation with partners to ensure that all NTD activities are recommenced safely and in alignment with the preventive measures against COVID-19. The first example of this tool being used in Nigeria is for the trachoma MDA that is planned for August. So, looking back at year one of the Ascent program in Nigeria, you would have heard that we have achieved our targets amidst challenges through our persistent hard work, and we give a lot of credit to our partners who have brought on influential stakeholders. Particularly of mention is the Federal Ministry of Health for the support that we have received so far. We can say confidently that we have delivered value for money with a low cost of £4 per treatment. And this we have achieved through leveraging resources and learnings from previous programs. And I can tell you that this is the lowest cost per treatment across the program that we have recorded to date. In Nigeria, we're raising the profile for leaving no one behind, health system strengthening, and community empowerment through advocacy. We have embedded a learning culture as a result of the Ascent program by scheduling intentional time to pause and reflect on our program work plans. We understand that there's a lot more work that needs to be done, but this presentation has tried to capture a summary of the significant year one of our flagship program for the Ascend. So this brings us to the end of this presentation. We will now take time for questions, comments, and we hope that we'll have the answers to your questions. So thank you very much for your time and attention. We hope that you've been able to learn something that you too will use in ensuring that together we beat NTDs for good and for all. Thank you.
Thank you so much, Joy. So yeah, we now have about 20 minutes for question and answer. So if you have a question, please feel free to either put it in the chat box or use the raise your hand function, and I'll help moderate the Q&A. So let's see. We already have one question in the box. So the question is, so to say on behalf of 3 states, Sokoto, Kebbi, and Zamfara, on planned trachoma MDA, I don't see the rest of the question. Yes, go ahead. You can unmute yourself.
Yeah, good afternoon, and thank you very much. It is Ahmed Ibrahim, PO Zamfara, speaking on behalf of 3 states, that's Sokoto, Kebbi, and Zamfara. We are scheduled to have a trachoma MDA this time around. Unfortunately, because of this COVID-19 lockdown, where we have suspended the activity. I'm sure all the 3 states have done their best in complying with the 5 steps processes concerning the risk mitigation for the MDE. We have drugs that will be due for expiration this August, apart from those that have expired in May this year. And I know how you people are trying to ease our affairs and work. My question is, could we be given a go-ahead to to complete the process of commencing MDE, considering the limited time period we have for the drugs to completely expire, which is, I believe, is going to be a very huge loss to us as an organization, and of course, even to our partners. Thank you very much.
So would somebody like to respond to Ahmed's question?
Well, yes, Alicia, thank you, Ahmed, for the question. Like you heard me mention in the last few slides, the focus for us as an organization is ensuring that we restart activities safely. And I think for us, the watchword is caution. So we understand that we stand the risk of losing drugs, but we have assurance from the drug manufacturers. They understand the COVID-19 situation, and we're working as much as possible to ensure that we have everything in place to recommence safely. So if you would, I would say, you can sleep with your eyes closed. We have everything under control.
Wow, thank you very much. Thank you very much, ma'am. Thank you.
Thank you, Joy. Samson, I see that you have your hand raised. If you'd like to unmute yourself and ask a question, please feel free.
Yeah, good afternoon, everyone. Hello?
Yes, hello, we're here.
Okay. I just wanted to appreciate Joy and Anita and Delphine for their presentation. Achievement that ASCEND has made in the first year. But I want to know whether there's a forum where ASCEND Nigeria will be, Sightsavers Nigeria will be able to share this experience with all the partners in the country, because I've seen some of those remarkable achievements that have been mentioned in the presentation, but particularly using the campaign approach to achieve 89% of coverage for MDA is very remarkable. I would have loved that if there's an opportunity for Sightsavers to organize a forum where this thing can be shared among partners and government in particular, so that we can upscale this kind of achievement across the entire length of the country. Thank you very much.
Thank you, Samson.
All right. Thank you, Samson. We appreciate the commendation. Like we mentioned, this is not possible for Sightsavers to do alone, and we appreciate that our partners are also get credit for what successes we have been able to achieve. And thankfully, on the 25th and 26th of this month, we have planned to have a partners meeting. This will draw all the NGDO partners and also the national NTD program. And hopefully, the focus for this meeting would be to share learnings from year one and walk through the things that we need to put in place going forward as we deliver on the other targets that we have on this program. So yes, we certainly are going to have to share this. And like we said, we are intentional about carrying on learning and taking time to just pause and reflect on our processes. So yes, that's coming up in a few weeks.
Wonderful, Joy. I think we'll be really looking forward to that. Does anyone else have a question? Let's see. Feel free to unmute yourselves if you do have a question, or put it in the chat box. We're getting lots of really nice comments. Great presentation. Thank you so much for sharing. It's been great to see how things have progressed since the United and UK Aid Match program days. Any more questions? Oh, yes. I see someone's hand is raised. Feel free to unmute yourself.
Yeah, hi everyone. My name is Jean-Jacques. I'm the Technical Delivery Director with the TPM, and I would like to extend my appreciation to the team and great presentations. I really enjoy it. I have just a quick question. So I've seen a lot of lessons learned from the past, and for all the activities you have undertaken over the last year with under ASCEND. But from my personal information, it looks like over the past year, the delay in drug arrival in country has been a problem. And from what I know, it looks like many LGAs, I don't know whether this is the right pronunciation, were unable to proceed with MGA due to drug supply and insecurity. So again, what is the main problem? Is the problem related to the drug shipment, the delay in application, the delay in processing the drug in country? What are you taking from there to solve this problem? It looks like this is one of the main challenges of the NTD program in Nigeria.
Yeah, good morning all. Probably before Joy or the country director speak on this, maybe I just chip in some few things that has happened over the years. Now, the issue of drug delay are coming from quite a number of fronts, and thankfully the Ministry of Health is tackling it, and we might probably not face as much program we have faced over the years. Now, the problem range from intersectoral delay between Federal Ministry of Health, Federal Ministry of Finance, and sometimes with the custom too. That's Ministry of Internal Affairs. But one thing that is certain over the last few years, our drug requisition always goes in March, which is the between March and April, which is the first batch of requests that goes through WHO to the drug donating body. But however, at a particular point in time, we had a change in government, and importation and waiver for donated items became a little bit stricter, because before now there are some people that have abused that system, and so that strict measures that are put in place now created problem for a system that previously seems to work seamlessly. And so people have to proactively get the required document to get this waiver. And we also had a point also of a transition period from UNICEF when somebody left who was supposed to apply for the exemption letter. A new person was in place and didn't know he needs to do that. That also caused a delay. But these are things that the Federal Ministry of Health have put in place. And the major thing that played a major role in most of the delay in the few recent years are the delay in getting IDEC, the import duty exemption certificate for these drugs. And also there was also a point where shipment, even from the drug donating body, we have to get information on what needs to be shipped in, and the manufacturer also want their warehouse emptied before they produce some more. So those also complicated some of the issues in the recent past. But however, as a country, the Federal Ministry of Health is on top of things now, and I can assure you now that most of our drugs are either at the port or already in the central warehouse.
Thank you, Enan. JJ, just to reassure you, this is Sunday speaking. Enan has really given you a very good background, and just to reassure you, we now have most of our drugs in country. In fact, Mectizan has arrived and is being cleared, which is always the biggest consignment. When you produce for Nigeria, you have to stop producing for other countries in Africa. And this is normally the biggest consignment because of the treatment, not only for onchocerciasis, but for lymphatic filariasis as well. So I can assure you that if it weren't for COVID-19, and they need to ensure that we put in safety protocols before we can resume. Treatment would have started already in some places because the drugs are available.
Thank you.
Okay. I think we have time for perhaps one more question, if anybody has a question they're wanting to ask. Right? Oh, Sarah, do you have a question? No? Okay. Well, if there's no more questions, then I will say thank you all again for joining us, and a really big thank you to Joy, Anita, and Delphine for presenting this afternoon, sharing their insights and learnings from Nigeria and how they are raising to the challenge to beat NTDs.